So in ortho, I really think helping the students get a 50,000-foot view is very important. So let me take you there and give you a quick sample. Every joint, I spend about a week and a half to 2 weeks on every joint for 2 semesters of ortho. At the beginning of the first day of class, while I'm talking about a lot of the conditions, I do not miss a chance to help map out how we are going to manage the common conditions in each body region. So as you know, for most body regions, there is going to be people with stiffness problems, mobility problems. There's going to be people with movement coordination impairments, people who move too much, right? The instabilities. You have instabilities at the knee, at the wrist, at the neck, at the low back. So here's the shoulder instability. The concepts of management are very similar. Keep them in neutral, calm the tissues down, strengthen the muscles around that joint, loosen things that are tight, and then teach them to move in ways that don't damage the structures. The concepts are similar. So I build on those same concepts week after week. A frozen shoulder, a mobility deficit, a stiff shoulder is the same as a stiff knee, is the same as a stiff elbow. They need motion, and I'm going to use mobility enhancing manual therapy and exercises to improve the patient's functional limitations. So they're going to see this repetition of these concepts. So in class, I'll say, guys, you've watched your online lectures, a little bit of your pathophys lectures. Let's map this out. So we can look at prevalence data. All of this is linked to PubMed abstracts. We can watch a video of how
shoulder pain with mobility deficits or adhesive capsulitis.
So what you can see is we've talked about the different stages. Wow, in the early stages, she's not that frozen. But she may be beginning to lose a little bit of external rotation. In the next phase, she's beginning to lose some motion. So I'm able to have these kind of clinical conversations that lead into things that students may have seen in the past. And then I'll just ask them, hey, guys, we think this is a mobility deficit. What do you think we should do in the exam? What have you already studied in the past courses that you think you're going to have to do for your examination? So you can see there's a clinical reasoning video about this patient, and the key things that you should probably be doing in your examination: physiologic range of motion assessment, active and passive range, accessory mobility, and these are the techniques that they're going to learn on Thursday and Friday. I'm just pre-exposing them, putting all of these techniques that are listed 1 through 100 on their lab sheet into some context that they recognize. And so then, if you talk about different conditions, shoulder impingement, all of their physical exam, all of their special tests are all organized, and they can pre-expose themselves to it. So it reduces the amount of overwhelming information that is kind of disconnected when they come to lab, because I've contextualized it for them. So then I talk them through this. We talk a little bit about, hey, what are some other common regional interdependence issues, associated impairments? Oh, thoracic spine, upper quarter muscle length assessments. This is a way for me to be able to create a web of reasoning, a web of thinking, with this laid out on the screen, so that it's not just all cognitive, me speaking into their mind. And then we talk a little bit about interventions. I ask them what have they seen, what kind of impairments they've seen that were managed. And so we talk about manual therapy interventions to improve soft tissue mobility, like pec minor, lats, or improve glenohumeral joint accessory mobility, or improve thoracic mobility. And then the matching therapeutic exercises, which won't come for another week, but I'll pre-expose them to it, and they now feel comfortable to learn as we go, to create context for themselves as the information is being delivered in small pieces. So that's a little glimpse of how the Ortho app works. I use this every week in Ortho to create mind maps, to create context for the vast amounts of stuff that I'm going to push into their brain. So I really think creating context early really gives meaning to all the little pieces that we give them.